Assalamu alaikum wa rahmatullahi wa barakatuh. Ashhadu an la ilaha illallah, ashhadu anna Muhammadan abduhu wa rasuluh. It gives me great pleasure to introduce two people. Certainly on my right is, on my extreme right is Councillor Tom McGee, who happens to be our local councillor, but he is actually chair of the Stockport Health Scrutiny Committee, and he's very active in healthcare. We're very lucky to have somebody like Tom here who gives us his experiences around Stockport, what health services offer, and perhaps what some of the inequalities are. I've got Dr. Usman, who's a local GP. He's the funniest GP I know, and I'm very proud of that. And of course, Inam as well. And they'll be talking about the common illnesses that we face, and they're giving you a presentation, hopefully. And I'm going to put a plug for them, which is called Askdoc. So if you go onto the Facebook and see Askdoc, these two and other people are behind it. And I've certainly been on it, and I've got some great things that I've learned from it as well. The whole thing about today is about your health and how people can actually look at their health. As Asians, predominantly that are here, we find that we have lots of problems in our family histories that we may or may not be aware about. So I'm hoping with Dr. Usman's presentations we can actually look at them and say, what do we need to do? So, if Dr. Usman is start.
Assalamu alaikum, brothers and sisters, ladies and gentlemen. Thank you very much for joining us today. I'll try not to bore you too long. It's myself and Inam and Talat, but I will do most of the talking today. And we've prepared a set of slides on the 10 common illnesses. It's quite hard to do that, 5 years of medical school training in half an hour, but we'll try our best, inshallah. Let's see if this technology works.
That's good.
Oh, hang on, we have to turn it on. Oh, there we go. Oh, was that you?
No, I pressed it.
That's fine. Actually, no, if you stay there, that'll do. So, if we whiz through some of the slides, and we talk about health first and foremost. And we ask the question, why is our health so important? And the way that we've looked upon it really, or the way that perhaps we should look upon it as Muslims, is that our health is an amana, is a trust that we have from God, from Allah Azza wa Jal. And it's our duty to look after our health, as Muslims. For a big reason is that a healthy body allows us to worship Allah, to worship God. And when I say worship, I say it in a very broad sense. Yes, the prayer and the Hajj and so forth, but also by being able to do acts of goodness, by being able to support your family, by being able to kind of work within the community. You need to do it as best as possible, you need to have good health. And one thing, we should also remember, we should also be grateful for our good health. The Prophet ﷺ said, when he mounted the pulpit and he wept, and he said, ask Allah Azza wa Jal for forgiveness and health. For after being granted certainty, one is given nothing better than health. And it's a very true scenario because, no matter how much money we have or what wealth we have, if our health were to go, really we are powerless to do anything about it. Yes, you have your doctors on hand and you investigate things, but if God wants our health to go, then we're powerless. And people will give everything they have to get better from their health. So the important thing is that, alhamdulillah, thanks to God that we all have good health, make the most of it now. In fact, if you learn nothing from this presentation at all, just take that away. Because I've seen it, unfortunately, too many times in my limited career, that you see young people, 40, 30, they've got a terminal cancer, their health is gone, and unfortunately they can't do the things they wanted to do. So make every moment you have last, make the most of your health, inshallah. So, let's go through these 10 common conditions we have, and there's one or two surprises in there as well. Heart attacks. Can anyone tell me what's a heart attack? What is a heart attack or myocardial infarction? You should all know from seeing,
Rich man's disease.
Sorry?
I say rich man's disease.
A rich man's disease. Well, it's possibly, but maybe not exactly. I'm sure you've all seen, 24 hours in A&E and all these embarrassing bodies. I haven't seen that, but I'm sure all these things on TV these days. In fact, you don't need to go to medical school anymore. Just watch Channel 4 and you have an honours degree. That's what Inam did actually. Yeah. So a heart attack. What's a heart attack? Can someone tell me? Give me a clue.
working as it should normal too.
Okay, yes, yeah.
And, the fails there, but comes in there.
Okay, yeah, yeah, okay. That's, sorry?
Sorry, hang on. Is it related to blood circulation?
Very good, yeah, that's excellent, excellent. Well, essentially what it is, I have to remind myself, and I have to put the slide on.
All right, sorry.
A heart attack is essentially is that you have a narrowing of one of your vessels in the heart. So the heart itself is like a muscle, and it has its own blood supply. Now, if one of the blood vessels to the heart gets blocked, what happens then is that that muscle cannot get the blood, and because it doesn't get the blood, it doesn't get the oxygen, doesn't get its food, and that part of the muscle dies, and that's a heart attack. And when heart muscle dies, it can't be replaced. So as Uncle says, if you have a major heart attack, all this muscle that was pumping blood around your body can no longer do that. It becomes a scar tissue. So your heart can fail, become ineffective. And there's a picture, I've got a picture here. A picture, which you can see, is so this is the blood vessels, and this is the heart muscle. And what happens if you get a blockage in the vessel, with normally like a clot, blocks the blood vessel, no more blood comes through. So this is where the purple blood vessel, no more blood, and this part of the muscle dies. So that's a heart attack. So they say in the UK, about almost 150,000 people have a heart attack in the UK. Most of these myocardial infarctions or MIs occur at over 50s. It's men, unfortunately, more than women. So men have to be careful. What are the causes, or what are often things related to this? Smoking is a big one. We'll come back to smoking later. Smoking, blood pressure, being overweight, diabetes, cocaine. So no cocaine, please. It's true. Cocaine has got a heart attack. Family history, things you can't change. Alcohol excess. Diabetes mentioned as well. Raised cholesterol. So there's quite a few number of things. But smoking is a very big one. People, they come to me and they're smoking 20 a day and they're worrying about their cholesterol. So don't worry about your cholesterol, stop smoking first. That will much reduce your risk. Someone has a heart attack, what are the common symptoms? Anyone can tell me? Seeing ER, what happens when someone has a heart attack?
Fainting.
Sorry?
Fainting.
Fainting, yeah, okay, you can collapse, yes, you can do.
Tight chest.
Tight chest, absolutely, yeah. Chest tightness, anything else?
Emphasis.
Absolutely, yeah, breath, yeah, very good, breath, yeah. What do they say? This pain comes...
You get pain going up on the side of your face, your chin,
Yeah.
and the left side of your arm.
Excellent. Also a doctor? Almost a doctor?
Because I had a
All right. Personal experience. So absolutely right. The chest pain, I imagine it's very severe, isn't it? So it can be, like sometimes it's like an elephant sitting on your chest or a very heavy chest tightness, but it can come in many different ways. But classically, chest pain goes into your jaw, goes into your arm. This is the classical kind of heart attack symptoms, but it can present many different ways. And many doctors have missed out heart attacks thinking it's indigestion as well, so it can present differently. So you have to take care with these kind of chest pains. Very quickly, if someone were to have a heart attack, there are various treatment options, and it's interesting now that probably we've seen in the last couple of years, what doctors do now is if someone's having a heart attack, they go to hospital and they can open up the blocked vessel. So we talked before. So here is a blocked vessel. So all this kind of cholesterol is a kind of a clot there. And what they do is now they can put a little kind of tube into your groin or into the wrist, all the way into this blood vessel, and open it out with a balloon or a stent. So here's this little balloon. It goes all the way into the blood vessel. It's amazing, isn't it, how they do it? And they open up the blood vessel and clears the clot, so the heart, again, gets a good blood supply. So these are things they can do now. We're very lucky, actually, around this area, because Wythenshawe is a major centre for doing this. So if you ever have a heart attack, take me to Wythenshawe. It's a good place to go. I think Stockport has a cath lab as well, and there's MRI, Manchester Ross. You correct me, yeah. So we're not too bad in this area. We can do things now to open up the blood vessels. We can give medication to open up the blood vessels, to improve heart function, to reduce the stress on the heart. But the biggest thing by far is try not to have a heart attack in the first place. And by doing that is trying to cut down all your risk factors. All these things you can do. Stopping smoking, controlling the blood pressure, controlling your diabetes, watching your weight, reducing your cholesterol, blah, 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 so forth. So that's heart attacks in a nutshell. Okay, measles. I throw this one in actually because lots of talk about measles. It's not so common because of vaccination, but it is a very common condition. So measles is a viral infection, but the issue with it is very infectious. If you're in a room with someone who's got measles for about 15 minutes or so, they say you can pick up the infection. And it was almost eradicated in the UK because of the MMR vaccination. But because there wasn't so much of an uptake, it's made a bit of a rise back, and we've seen in Wales there have been a number of cases recently. But measles, what it does, it causes the usual viral type symptoms, the cough, the runny nose, the fever, unwell, all that. And you classically get a rash that often starts on the face and behind the ears and it spreads downwards. This is the kind of the typical measles rash. The good news, in the majority of cases it gets better by itself. You don't need to do much for it. Paracetamol, ibuprofen and thyme, and generally it gets better. However, the thing with measles, why is there concern, is that for some cases there can be complications. Complications such as ear infection, pneumonia, meningitis, encephalitis, squint, hepatitis. So meningitis you've all probably heard of, serious conditions. Pneumonia, so severe chest infections. So it's very important that we get on top of measles, that we get ourselves vaccinated or our children vaccinated, because the complications are almost preventable. And it's all naivety if we don't get vaccinated, and hence, we can end up with these complications. This is a picture of a measles rash, typical measles rash. So in case you see a case. And a very quick slide on the MMR vaccination. So this was a big talk. This was, I think, back in 2000 or something, wasn't it? When this paper came out, some research saying that measles or MMR caused autism. There's no evidence for that. There's no evidence, and the person who's written the paper is no longer a doctor, from what I understand. So there's no evidence for this autism. So we would recommend that your children you have the MMR vaccination. My children have, the vaccination was introduced in 1988. So some of us will not have had this vaccination. If you're born before 1970, you're probably okay. You probably had it at some point and you're fine. But if you're born between 1970 and 1979, you may not have had the full vaccination. So you perhaps need to have a check with your GP whether you need it or not. But if you're older than that, then it's all good. You're okay.